Welcome back. October is Breast Cancer Awareness Month, and Dr. Schmitz is here to remind all women and men to get checked out.
Absolutely. We have the lit up pink ribbons on the courthouse and the Susan G. Komen Race for the Cure tomorrow. So all reminders, October is Breast Cancer Awareness Month. And just reminding women to get your mammograms done and the physical exams done. And we do follow the American Cancer Society guidelines that recommend that women get baseline mammograms starting at age 40, sometimes earlier if there's a family history of breast cancer, other concerns, something to talk about with your doctor. But and then, of course, to have the annual physical exam after age 40, and really to be done by a professional every 2 to 3 years for women, even in their 20s and 30s. But last year there had been a report from the government saying maybe to have women start their mammograms at age 50.
That just seems a little late.
It does, because I was looking back on our women who were treated with breast cancer last year at the Regional Hospital Cancer Center, at Stephen Morgan Cancer Center, and literally at least a fourth of the patients were less than 50.
Wow.
And so if they had waited to have their mammograms or exams done, it may well have been too late.
And early detection, it's key.
It is. Women have so many more options if it's caught early, lumpectomy instead of the whole mastectomy and that type of thing. Oftentimes not the need for chemotherapy and some of the other more advanced treatments. And everybody knows somebody who's been touched by breast cancer, and when it's caught early, many success stories, highly curable if caught early. And then we all know situations where it's been caught late with not good turnout.
So really the key is talk to your doctor, make an appointment, and start getting screened early.
Absolutely.
Okay.
And there's a lot of information out there. American Cancer Society has a great website and contact at the cancer centers in the area. But we're just reminding women to go ahead. I know it can be an anxiety-provoking thing to get that done, but the majority of women will get a good report and they'll be reassured. And the other women who might have something found, that's the whole idea, and you want to catch it early.
In regards to breast cancer and treatment, where are we now?
Oh gosh, we're making great inroads in terms of some of the systemic treatments, some of the more localized forms of radiation therapy given for early stage breast cancers. They're just fine-tuning who needs what degree of breast cancer treatment. Different oncogene studies, and they can determine whether a woman who's kind of borderline may or may not need chemotherapy, for example, and studying their genetics of that tumor cell. So there's a lot of things on the horizon.
And if you have any questions, folks can just call Terrell Regional Hospital.
Indeed. And the American Cancer Society also has a great website and great information, but all those sources. And
I just want to quickly plug that the Race for the Cure is taking place in downtown Terre Haute tomorrow. Everything's going to kick off with registration once again at 6 in the morning. Online registration has closed out at this time, but the place to be tomorrow early morning in recognition of Breast Cancer Awareness Month is the Race for the Cure in downtown Terre Haute, again at 6 in the morning. If you have any questions, I encourage you to go to their website at ComenWabashValley.org. News 10 at midday. We'll be right back. Stay with us.